And we're live with another episode of On the Record with Tiffany. And I'm here with one of my favorite guests, Dr. William Henrich, the president and CEO of UT Health. So how are you doing today, Dr. Henrich?
Couldn't be better. Good to be with you. Nice to be here with you.
Thank you. I want to talk to you about all of the great projects that UT Health is doing. Can you tell me about your little secret? Now, when I scheduled this with you, you didn't reveal to me that you were going to be opening a research hospital.
We are, and so let's start with that.
Yes.
This is a major project for us. It's the first time in our history, 51-year history, that we are endeavoring on to do something like this. So let me start with the why of it. We have had many great partners in the clinical space in San Antonio over the course of our history. University Health Systems have been a great partner and still is a great partner. It's our primary partner. The Veterans Administration, the private hospitals in town, the Tenet Baptist system, the HCA Methodist system, and the Christus system have all played major roles in training our students, training our residents, and providing homes for our faculty for different programs in different places. In the past several years, we've seen an enormous growth in our clinical practice, our outpatient practice. And so as that has occurred with a growth of 8%, 10% a year, we realized that we needed a place to carry forth our clinical work and to carry out the most sophisticated clinical trials that our city and our city's residents should have at their fingertips. You know, one goal of creating a space like this in the hospital realm is that we want to have a place that offers the most sophisticated care, the very best care, so that no one ever will have to leave San Antonio and go someplace else. So the motivation behind this is to create that kind of hospital. And we hope to get final approvals and break ground for it in the spring of 2021.
Wow.
And then hope to put a shovel in the ground and start drilling in the late spring, early summer of 2021. The project will take 3 years to complete. The hospital will have about 2/3 of it dedicated to medical oncology, that is inpatient cancer care, and surgical oncology. And then there'll be some other highly articulated services in there as well. So we're really excited. It will not duplicate, you should know this, Tiffany, it's not going to duplicate what we have with our partners at UHS, because we decided early in this project that we needed to keep those successful projects going where they are. They require great numbers of teams, and UHS has been a great partner, so we want to keep those places there. So we are building this hospital to complement what we have at UHS, and in so doing, we hope to create a system of care that will be available to everybody in San Antonio, distributed across the city with regard to outpatient sites, and then have these hospitals be a really welcoming place for people who need to be hospitalized.
And this is why, and I'm stopping you right here. When my listeners are hearing you and people who are watching us see you, I want y'all all to know this level of vision is why he was invited today. Our city is the 7th largest city in the United States. When the pandemic that we are currently going through hit, it's places like San Antonio that were able to adapt. We were able to look at, and I talked to I'm sneaky. I talked to Jennifer Melton before I talked to you. So I could get the lowdown on what's happening over there. And so you guys, your team, because I know it's not just you, but you built this team. Your team was able to look at what happened in New York. And for all intents and purposes, we could have had the same sort of just explosion here. And they were able to adapt. And that's some real adaptation, because that's having to adapt quickly to an unknown predator and protect all your people at the same time.
Mm-hmm. No, you're right. I'm incredibly proud of the, use the right word, team of people that went into the fire.
That's right.
You know, it's they're brave, they were courageous, they were resilient in doing so, and the complexity of preparing for something as unprecedented as what we have been going through created new challenges in communication, new challenges in how to build redundant teams that could spell each other and not lead to the impressive rate of burnout that was seen in New York, in Boston, in Seattle, Chicago, Detroit. So I'm incredibly proud of them. I'm also proud of the community education outreach that took place with leaders advising our mayor, our county judge, trying to get the stop the spread methodology out to everybody so that we could amputate the peak in the COVID disease pattern, and then we stood up the best test, I think, in the city for looking and a quick turnaround test for testing people who were at risk, and testing sites under tents, drive-through. I drove through one of them,
and that's one of the things I like about you, is that you're hands-on. You're not just like, well, I'm gonna, I'm the guy in charge. I don't have to drive through that.
No, I did. Actually, it was nose on. I mean, I offered my nose to the tester, and she tested me. So listen, it was a lot of teamwork, and I say bravery because it wasn't just that they put their own lives at risk. They put their families' lives at risk. And these are people with children and spouses and aunts and uncles and parents at home, just like us. And so their doing this was inspiring. It was inspiriting to see the way that it was handled. So I appreciate your bringing it up, because I'm really proud of them.
I'm proud of them, and I'm proud of you, because when it comes down to teamwork, not just within UHS, but you all reach out to other hospitals. You have wonderful programs that where you collaborate with others. You know how unheard of that is in the academic world. You know your peers. Everybody. These are intelligent, brilliant people who like to win, and it can be tough to get them to want to work together, because everybody wants to win. We're a competitive ilk, so you want to do your very best.
The objective here was this: we were all in peril, and lives were in peril, and our city was in peril. By the way, I should say, probably not refer to this in past tense, because the reservoir of the virus continues to be a problem around the country, as you know. And as we're doing this interview today, other states in the upper Midwest are experiencing the kinds of spikes that we experienced after the Memorial Day weekend in the end of June and July and in that time frame. So lives were at stake, and when I say team, I should expand the definition to include many people outside of UT Health. All the hospitals, all of the clinics wanted to be a part of this and get their hands on the ore for us to get through this. And I'm pleased with the success we had.
You know, to all of my listeners, I just want you all to come on back and listen to Dr. William Henrich, the president and CEO of UT Health, because he is showing us what being an American is, what being resilient is, and the spirit that exists in our beautiful city. The beauty of the people that work here, live here, and take care of all those who work here and live here. I'm very thankful that I get the pleasure of spending time with him and getting to know his team. They are some of the best people that I've ever met, and they have helped many that I serve in my day job and that I have in my own family. You know, so I thank you, Dr. Henrich, and everybody come on back and listen a little bit more, because this guy's pretty okay. He has some good things to say to you. So, and you've been listening to On the Record with Tiffany.